Hello, this is my teaching video for Dr. Chilungu's class. I'm sorry if I'm saying your name wrong. I am a little bit under the weather, so if I'm coughing a little bit or taking a sip of water, that's why. In this video, I will be discussing like sex education and topics related to that. So I definitely think the audience for this video is around late high schoolers, so 11th and 12th graders to college students. Yeah, as for my assessment for this, I'll probably just be doing a small exit ticket as well as questions throughout to kind of gauge the participation. I have one person in my audience. I'll just flip the phone over because it's just looking at me. And that is really all. So throughout this lesson, we're going to be touching on a couple of different topics, only really touching the surface of them, but comprehensive lesson nonetheless. So we'll be talking about consent and its importance, the types of sex, three main ones, contraception, STDs, and STIs. That is all. So first we are talking about consent. So can anyone give me an example or a baseline idea of what consent is?
Consent is making sure somebody is okay with what you're doing.
Right. That is good. Just in case you couldn't hear, she said that consent is making sure that someone is okay before you do something. That's what you said, right? Okay. So that is exactly correct. Consent is checking in and making sure that someone has, for lack of better words, consented or is okay with what you are about to do to them and is understanding of what is about to happen. So a really great acronym for remembering what consent is FRIES. FRIES obviously stands for something different. So FRIES. F stands for freely given, R stands for reversible, I is informed, E is enthusiastic, and S is specific. So just straight off the bat, what do you guys think is the most important thing from the FRIES model? I'll repeat the FRIES if needed.
Informed.
All right, why do you say that?
Because you need to know what's about to be happening that you're consenting to.
Exactly. So, thank you for your input, student Emma. So, now we're just going to talk about the different letters individually. So, F being freely given. Obviously, consent is not given under any type of pressured circumstance. It is out there and willing. So, let's say if you want to kiss someone and you'd say, "Can I kiss you?" And they would say yes, and then you would proceed. Versus, "I think you should really give me a kiss right now because I want to kiss right now. You want to kiss?" And then they say no, and you're like, "No, you sure you don't want to kiss me? You should kiss me like right now." And then they finally say yes. Is that freely given?
No.
Right, because they were what happened in that scenario?
Pressuring you in a sense.
Right. So that completely removes the freely given component of consent. So the next one is R, meaning that consent is reversible. So that means if you say yes to one thing, but you don't want that one thing, you can say no in the middle of it. Or if you say yes to one thing and you move on to a different activity, you can say no after that. So let's say someone gives you a hug and you're freely consenting to that hug, but then they try to kiss you. And then it's like, I don't want a kiss from you. So you can say, no, I don't want to kiss, and therefore it is reversible. Now as I, inform, being exactly what you said in the beginning, that you are aware of what is happening, and there's not any gaps in it. So if you want to, ask a question about it, or what are we about to do next, that is the space to do so that you are aware of everything that is about to take place. I also forgot to mention this in the beginning, but this is more of like a lecture discussion based conversation. Okay, back to the E. E is enthusiastic. You are happy to give it, right? So it's like, "Can I kiss you?" And you're like, "Yeah." Is that enthused about the behavior is about to take place?
No.
So if someone asks, "Can I give you a hug?" what would enthusiastic sound like?
Of course.
Exactly. You sound happy for that hug. And lastly, specific. Because specific kind of ties into being informed. It's very particular to what action or behavior is about to take place. And whoever the parties that are taking place in it are aware of what is happening. So extremely specific. So I am going to hug you, or I'm going to kiss you. And yes, this can sound very tedious and time consuming, but consent is really important. You want to make sure that all parties involved are comfortable. Back to the video. Alright, so now that we have discussed consent, we're going to discuss a few activities that consent is typically given for, and that is sex. So there are 3 main types of sex that I will be discussing in the video, and that is oral sex, anal sex, and penetrative sex. Alright, so as I mentioned in the previous order, we will be talking about oral sex first. And oral sex is obviously anything that involves your mouth or another person's mouth. So whether you're using your mouth on them or they're using their mouth on you, that is oral sex. Again, you know, it's important to be protected at each of these sex, no matter if you're using your mouth or if you're using your rear end. They are all important to use protection at. So next, we'll be talking about anal sex. So as the name implies, anal sex is anything that uses the anus, which is your butt. So if something is inserted into the anus, or you are inserting your something or another object into the anus, and that is anal sex. Again, protection is important at this stage as well, and we'll be talking a little bit about protection in the next stage of this lesson. And the last type of sex we'll be talking about is penetrative sex, which usually will involve the vagina and anything that is penetrating the vagina. Now, again, important to use protection in this stage as well, and important to use consent at each stage, because remember that consent is specific and informed. So if you consent to oral sex, but you may not consent to penetrative sex with someone, it's important to keep that in mind. Now, it is important to remember that at each stage of sex, or throughout whichever one you partake in, if there is pain and something that is excruciating, you are welcome to stop. Also, remembering that consent is reversible. If you say, hey, I don't want to do this anymore, someone should listen. Alright, so now that we have discussed the types of sex as well as consent, we will be discussing the types of contraception available to you. So, the first type of contraception we'll be talking about, and one that is very widely available, are condoms. Specifically, male condoms. Male condoms are non-hormonal, and they are pretty effective, 98% effective, against not getting pregnant. And condoms are also really great because they also protect against STDs and STIs. Yeah, condoms come in like very different materials. Most commonly you will see latex, but if you have a latex allergy or your partner has a latex allergy, they also sell non-latex condoms. And another form of contraception is the birth control patch. Now, the patch is hormonal and it has a 99% effectiveness when used correctly, but you do have to change it weekly, which gives it a little bit of maintenance. And you can choose to have menstrual cycles on them or not menstrual cycles, and patches can be stuck anywhere on you. So most commonly you may see an arm or the stomach where a patch is placed. The next type of contraceptive that you have are pills, and you have 2 types of pills. So you have a combined pill and like a progestin only pill. Now both of these options are hormonal as well, with a 99% effectiveness rate. They do have a pretty high maintenance, as you have to remember to take them daily for it to be of the utmost effectiveness. And you can also choose to have regular periods on the combined pill. So the next type of protection that you will see are female condoms. And female condoms are inserted vaginally, and they also help to protect against STDs, STIs, and pregnancy. When you are using the pill, it is still important to make sure that you are using a condom with the pill, because pills on their own do not stop STDs and STIs, although they are effective in preventing pregnancy. And I actually meant to stop midway here and ask the class, have you all heard of any of these types of protection before?
Yes.
What have you heard of?
Condoms, birth control, all that good stuff.
Do you think like there's a level of importance when using these?
Yes. I feel like they're important to keep yourself safe and protected from STDs and different diseases and germs.
Yes, I agree. So after our tiny mid-break, there are just many types of contraceptives available. So after our female condoms, you have the implant. Now the implant is also hormonal, so the only two that you're going to really see that are non-hormonal are condoms. Everything else is hormonal to ensure you don't get pregnant. The implant will go into your arm, and it does have 99% effectiveness, and it's about one of the more low maintenance ones on the list, because it goes into your arm and it just stays there for about 3 years and it keeps a great effectiveness. You next have your shots, otherwise known as like the depot shot or depot, but it is the exact same thing. It is hormonal as well. It is 99% effective, and you'll go to your doctor around every 3 months to get your shots and make sure that you're staying up with it. Now the last one that we will be talking about is the IUD, and IUDs are inserted into the vaginal canal, and it's just inserted up there, boop, and it will also help protect against pregnancy, and it is hormonal. We have this handy dandy condom here for a condom demonstration if you have never seen a condom before. And I hope this one has a package. Oh, yeah, it does. So what's important is when you're using condoms, number one, to make sure that it's kept in a clean, dry place, not in a wallet. I know this is like a very common place to put it, but it does get hot in there, and it is latex, so, you know, a little less effective. So when you take it out the package, you want to make sure that you move it around to ensure that there are no air bubbles, because if there is an air bubble or, you know, something's coming out of one place, there's a hole in it, and don't use it. This is exactly how it was demonstrated to me when I did it. This is hilarious. Okay, banana. So when you put it on, it may be a little slippery. You want to make sure that you're sliding it down the right way. So if it's going the wrong way, it'll have a little bit of what? It's okay. It's a demonstration.
Okay.
What's happening? All right. So if it's not rolling down well on one side, you can flip it and roll it down the other side, and it should go all the way down, which I don't think it's this side. I think it's the other side, actually. But either way, a perfect demonstration of how it should occur when you are engaging in sexual behaviors. And voila, you roll it down and the entire banana fits. So if you engage in sexual behaviors with someone, a common topic or something that they may say is that their penis is too big for a condom. And I'd like to demonstrate that this banana fits very well. And there's also condoms in multiple sizes, so please stay safe and protected from STDs and STIs, which is what we'll be talking about later. So now that we have talked about contraception, and I know that we have heard me say that although birth control is effective, it should still be paired with condoms because it can protect you from STDs and STIs. So now we're actually going to be talking about what exactly STDs and STIs are, and the 3 most common types of STDs and STIs that are seen in the United States. Now, class, what are some STDs and STIs that you guys have heard of?
Crabs, mono, syphilis, chlamydia.
So it's quite the list of, STDs that you've heard of, and there are even more out there. It's not an exhaustive list what I'll be presenting today in class, and it's important to make sure that we stay protected against all of them and that you get tested at your local clinic every 6 months. 3 months if you're super active. But as you listed, you said like crabs, chlamydia, mono, and there are actually one of what you mentioned is actually one of the most common types of STDs, which is chlamydia. You said chlamydia, right? Okay. So STDs stand for sexually transmitted diseases, and they are infections that spread from one person to another, typically during vaginal, oral, or anal sex, which are the 3 types of sex that we mentioned. And this definition is directly from the Centers for Disease Control, or CDC for short. And there are actually 26 million cases of STDs reported in 2018, which is quite a lot of people. And of those 26 million cases, some of the most common STDs that we're seeing were HPV, or human papillomavirus, gonorrhea, and chlamydia. Now, HPV is the most common STD that is seen through the CDC reports, and about 80 million people are infected with HPV each year. And out of those 80 million, 14 million are teenagers, so it's probably really important to make sure that this is being presented to a high school audience or early college audience, because that is between like 16 and 19, which is a very common age, and those are teenagers. Now, HPV, there is a shot that you can get for HPV at your local primary care physician, and it is 3 rounds. I believe I had 3 rounds of the HPV shot, and it generally presents with no symptoms. Although some people may experience warts on the genitals, their mouth, or their throat. And it's really important to be protected against HPV as well as other types, but HPV specifically, because HPV can advance to cancers, which is cervical cancer and oral cancer. Now, with the HPV shot, although it's a great preventative measure, there is a time frame that is considered to be the most effective and a time frame where it's not considered to be effective at all. So between 11 and 12 is the most effective age for the HPV shot. It is safe to be given during the teen years, but after a person surpasses 26, it is no longer considered to be an effective form of HPV prevention. So if you are older than 26 and maybe listening to this video, please use condoms and get tested. So the next type of STD that we'll be reporting, as Emma said here, is chlamydia, which is common STD, one of the most common ones that you'll see, and it's reported to local health departments commonly and the CDC. And it is a bacterial infection, and it can also be cured with antibiotics, but if untreated, it can cause serious health complications, just as anything that is untreated can. It is an infection, and it spreads to the uterus in women and fallopian tubes, and can lead to pelvic inflammatory disease, and that can lead to permanent damage in the reproductive system. And I'm sure it also causes some permanent damage to the reproductive system in men when it presents in men. So symptoms that a person may have chlamydia are painful urination, they may have pain during sex, or any type of abdominal pain, and off-colored discharge. My apologies. So if you know your discharge is typically, I don't know, white or something, and it's like green, that may be a sign of an infection. And also abnormal discharge from the genitals. So if you have a penis and you are noticing also green discharge coming from the top of your penis, you should also get tested for chlamydia. Alright, so the next STD that we'll be talking about, and it's actually the most commonly repeated one, second most reported one after chlamydia, is gonorrhea. Now, gonorrhea, like chlamydia, is a bacterial infection that can also be successfully treated with antibiotics. And again, just as chlamydia, delaying treatment can lead to complications. And untreated gonorrhea can also report pelvic inflammatory disease in women. And on top of that, it's really important to get gonorrhea treated because it can increase one's risk of contracting HIV. So, gonorrhea, unlike chlamydia, can often not present with symptoms, but some of the most common signs and symptoms that you will see if someone is presenting with gonorrhea is painful urination, abnormal discharge as well. You'll have bleeding between your menstrual cycles, so maybe say you already had your cycle for a full cycle in between that month and you're spotting like a week afterwards. That may be a sign that you have gonorrhea, as well as swollen testicles. Now, it is even more important to stay protected when engaging in sexual behaviors to obviously protect yourself from the 3 STDs mentioned, HPV, gonorrhea, and chlamydia. But on top of that, if you are pregnant and you have faith, you're going to give birth, the child can also catch it through the birth canal, which is, sad. So, when talking about STDs, and as I mentioned, how do you know if you have an STD? Well, you'll know if you have an STD, number one, if you are presenting symptoms of an STD, and also if you go to get tested at your local clinic, Planned Parenthood, primary care. There are many places that will perform STD testing. You're also a local university clinic, and you want to do that every 3 to 6 months if you have if you are super sexually active, meaning more than one partner, and also at least once a year for syphilis, chlamydia, and gonorrhea if you have one sexual partner. Now we are going to enter the question and answer portion of our lesson, and we are going to have a quick debrief and exit ticket. Are there any questions?
What if I don't want to catch any STDs, but I also don't want to use any contraceptive.
All right, that is a great question. So her question was, what if I don't want to catch any STDs, but I don't want to use any contraceptives? And the solution to that is one of the best ways to prevent it is abstinence, just not engaging in the activities at all. However, if you do engage in the activities and you don't want to use any contraception at all, I think it's really important to ensure that you have a partner that is monogamous to you and only you, and that you are frequently getting tested for STDs and STIs, because obviously not using contraception will increase your risk of catching something exponentially. So, are there any other audience questions?
What are my chances of getting pregnant with and without a condom?
All right, so your chances of getting pregnant without a condom, you have about an 85% chance of getting pregnant, because 85 out of 100 women who do not use any type of protection at all, including condoms, birth control, or anything of that sort, do get pregnant. Now, if you still want to prevent pregnancy, but you don't want to use protection, you can take the morning after pill afterwards, which will kind of prevent, like, the actual process of fertilization. However, it is important to make sure that you're only using this as a plan B. No pun intended, it is called a plan B, but because they do get ineffective with increased usage. And they also have a weight limit, so also look into that before you choose to use a plan B. With a condom, your chance of getting pregnant are pretty low. You have about a 99% chance of not getting pregnant. So if pregnancy is your biggest concern, I definitely recommend condoms paired with any type of the birth controls mentioned. So that may be any type of, pill, IUD, shot, or the insert into your arm.
I can ask some more questions.
All right. So do we have any other questions?
Yes, I have a question.
Yes.
Is sex bad for you?
That is actually a really good question, because sex gets a connotation of being good or bad, but sex is neither good or bad for you. Well, it's actually good human release, but it is not bad for you. It is just something that you have to make sure you do when you're both mentally and physically ready to engage in it, and something that you understand the repercussions of it as well, STDs, babies, and again, emphasizing that you are just really ready for it, that you're comfortable with whoever you're doing it with.
Thank you. Can I get pregnant the first time I have sex?
That is also another really good question, and a common misconception is that you can't get pregnant the first time you have sex. But yes, you can get pregnant the first time you have sex if you are not using any type of protection, and you're not on any type of birth control, and you're just having sex. There is obviously a possibility that you may get pregnant. There are about 85 out of 100 women get pregnant who don't use contraception, and there might be a chance that you are that lucky 15, but in the case that you are not the lucky 15 and you are the 85, yes, you can get pregnant your first time having sex. But if you want to reduce your chances of getting pregnancy, obviously employ some of the methods of contraception that I talked about in the beginning, such as, condoms, IUDs, and birth control, or even pairing birth control with condoms together for an increased effectiveness. And in the case that a slip up just happens, there's also just the plan B.
Thank you. Last question. How do I ask for consent without ruining the mood?
Yeah. So consent sometimes can be deemed as a mood ruiner. If you're in the middle of something and you're like, well, I don't really want to crush it by asking someone. But consent is always sexy, because it's very important that both parties feel comfortable. Whether you're a girl or a boy, it's important to make sure that both parties feel comfortable. So you can just ask, like, is this okay? Do you like this? Can I do this? There are multiple ways to just go about asking it without having to stop midway and just back all the way up and say, can we do this now? So just gauge your room, but it's also great to talk to your partner and see how they want to be asked about engaging in sex. So that just about wraps up the lesson. If there aren't any more questions, did you guys learn anything useful from this presentation, this lecture, discussion? Were there any likes or dislikes, anything that we feel I could have done better for the next time that this is presented?
I think the presentation was great and extremely informative. Thank you so much for educating me on sex.
Yay. Did you learn anything new?
Yes, I learned about the statistics of pregnancy, and I learned about some more contraceptive methods, and more about consent. The FRIES method was new to me.
So do you remember what like the FRIES stands for? This is just like a little quick little assessment.
Yes. Free something.
Freely given.
Freely given. Informed.
Okay.
Enthusiastic. Specific. And I don't remember the R.
It's like we're spelling a different word here. Pfizer.
I didn't do it in order.
R is for reversible.
Reversible, yeah.
Yeah. So at the beginning of the lesson, you said that you felt like the most important one was I, having informed consent. Do you still think that that one is the most important? Do you think there's a different one of importance?
Now I think that freely given and informed are the most important.
Yeah. Freely given and informed are definitely important aspects of consent. Do you think that there were, now we're just kind of getting into the debrief of this, do you think that there were any particular weaknesses in this plan?
In the FRIES plan?
No, in the plan overall.
Oh. No, I think you did a thorough job. It was good. Thank you.
All right. Would you use this in your classroom if you were a teacher? Would you hire me for the sex ed talk?
Yes, I would.
All
you
right.
had great examples, and you even had a little showcase with the little banana, which was cool to watch. Very nice. I liked it.
Well, thank you very much. This about concludes my video. Yeah. Bye-bye.
Bye.